Hello, my name is Pashla Green, and this is our supervisor training presentation brought to you about signs and symptoms of drug and alcohol. We're going to focus on our learning objects or types of drugs: alcohol, marijuana, cocaine, crack, hallucinogens, PCP, and amphetamine. And we're going to discuss about the physical indicators, the behavior indicators, speech indicators, and performance indicators that goes along with dealing with these types of drugs. The purpose of this lesson is to demonstrate the possible signs and symptoms of drug and alcohol usage on a job. Alcohol. Alcohol is the number one problem in American workplace. Between 10 and 15% experience a misuse of alcohol and or drugs. It's reported that an estimated of 150 billion people per year has lost in productivity due to sick leave, absenteeism, decreased morale, errors, and accidents. Alcoholism is an illness with known physical, social, and psychological causes and cures. It diminishes mental and physical processes, leading to insufficiency, errors, and accidents. It's dangerous to operate vehicles or any type of machineries after drinking even small amounts. It's seriousness that it can cause a fatal accident or fatality. The emotional effect that it has is depression, agitation, anger, fatigue, confusion, especially on medication, effects of alcohol, you're stumbling with your balance, your posture, coordination, judgment. You are not of impairment. You think that you're fine, but in actuality, you are drunk. Your reaction time slows down, and your health perceptions. Physical indicators will be speech pattern, slurred speech, smell, avoidance, staggering walk, exaggerated behavior, laughing loudly, or maybe arguing, lack of coordination, and dull mental process. Health effects. Chronic consumption of alcohol, average of 3 drinks a day, over time may result in health following health. Decreased sexual functioning, dependency up to 10% of all people who drink alcohol become physically and or mentally dependent on alcohol and can be termed alcoholic. Fetal liver disease, increased cancers of the mouth, tongue, esophagus, rectum, breast, malignant melanoma, kidney diseases, ulcers, birth defects in pregnant women. Up to 50% of all birth defects are alcohol. Next is marijuana. The chief mind and body altering ingredient is THC. Marijuana affects the brain and nervous system within 15 minutes. When smoked, marijuana gives off a distinctive, heavy, sweet, burnt rope smell. It reduces the ability to drive and operate equipment safely. Marijuana is linked to worker theft from co-workers as well as accidents, reduced productivity, and job loss. Physical effects, mental functions, delayed decision making, impaired short-term memory, interfering with learning, erratic cognitive function. Physical indicators, reddening eyes, often masked by eye drops, slow speech. You have the I don't care attitude, irritating cough, chronic sore throat. Different types of health effects. It can cause cancer, substances equivalent to half to 1 pack of cigarettes, can cause serious respiratory tract and sinus infections, Chronic smoking causes changes in brain cells at brain waves. Acute overdose effects, heavy sedation, immobility, aggressive urges, anxiety, confusion, fearfulness, hallucinations, the list goes on and on. Next will be about the cocaine and crack. Cocaine possessions are used as illegal. Conviction can cause the company to lose all federal contracts. Workers on cocaine tend to be hyper, irritable, and paranoid with wide mood changes. Cocaine can trigger seizures, cardiorespiratory collapse, heart failure, extreme psychosis, and also death. Cocaine is not physically addictive, but is easy to develop a powerful psychological dependence after just a few uses. Some physical indicators is running or irritated nose, difficulty in concentration, overreaction to stimulus, and paranoia. Physical effects, mental functions, increased physical activity and fatigue, wide mood swings, restlessness, hallucinations. This is a list of the different health effects and workplace issues. Dealing with the health effects, it may upset the chemical balance of the brain, resulting in the acceleration of aging process by causing irreparable damages to critical nerve cells. Also, it causes spasms of blood vessels in the brain and heart, which can lead to ruptured vessels, causing strokes and heart attacks. Dealing with the workplace issues, its financial problems can lead to workplace theft and or dealing, isolation and withdrawal from normal activities, secretive behavior, frequent non-business visitors, delivered packages, phone calls, paranormal and withdrawal create unpredictable and sometimes violent behavior. Amphetamine. Physical effects for amphetamine will be the mental functions will be hyper excitability, restlessness, confusion, panic, talkative, and ability to concentrate. Physical indicators, dilated pupils, profuse sweating, rapid respiration, confusion, panic. Workplace issues is used to elevate the sensation of fatigue. In health, fetal means may be abused, to increase alertness because of unusual overtime demands or failure to get rest. It gives you a false sense of alertness because carelessness, which can lead to accidents. Health effects, strong psychological dependence, and increasing tolerance to drug. High doses may cause toxic psychosis, resembling schizophrenia. Also, chronic use may cause heart and brain damage due to severe constriction of capillary blood vessels. Hallucinogens, PCP. Hallucinogens are mind-blowing drugs that vastly distorted what is seen and here creating extremes, dangers in the workplace. Users may undergo sudden, dramatic change in their personality. It is also known as angel dust. Physical indicators will be dilated pupils, profuse sweating, rapid heartbeat, dizziness, loss of balance, confusion, agitation. Physical effects, impaired reality, impaired conditions, impaired judgment, psychotic, extreme mood shift. Health effects, potential for accidents and overdose emergencies is high due to the extreme mental effects combined with the anesthetic effects on the body. Workplace issues. PCP abuse is less common today than in recent years, not generally used in a workplace setting because of the severe disorientation that occurs. Many abusers become violent, attacking others, believing that they need to save their life. Heroin. Heroin is a major cause of absenteeism, reduced productivity, emotional problems, and job loss. Heroin is a downer that slows down the body's psychological processes. Heroin is extremely dangerous. It Heroin is extremely dangerous. It leads to gradual physical breakdown, severe infections, hepatitis, AIDS, and death from overdose. Symptoms of overdose will be slow and shallow breathing, clammy skin, convulsions, coma, and then death. Physical effects, the mood change, depression and apathy, physical fatigue and drowsiness, impaired coordination. Physical indicators, tiredness, nausea, vomiting, constipation, dilated pupils, and slurred speech. Social issues. There are over 50,000 heroin addicts in the United States, most of whom are IV needle users. An even greater number of medicine narcotic dependent persons obtain their narcotics through prescriptions. Dealing with the workplace, heroin addicts are not usually found in a workplace. Chronic heroin users tend to have a lackadaisical, I don't care attitude about everything from going to work to talking, taking a bath to eating. There's unwanted side effects such as nausea, vomiting, dizziness, mental clouding, and drowsiness place the legitimate user and abuser at higher risk for an accident. Now, we have went over the 5 different types of drugs that is used in the workplace and alcohol. Here's a summary of warning signs for substance abuse. The existence of an alcohol or drug problem often manifests itself in its employees' work performance behavior or appearance in the following ways. 1. Excessive absence and hour tardiness, especially after a weekend or a holiday. 2. Frequent requests for time off during a workday. 3. Numerous accidents without explanations. 4. Patterns of accidents in area during shift change or time of shift. 5. Noticeable increase in medical insurance claims, particularly for non-job injuries. 6. Unsatisfactory work performance. 7. Lack of concentration or decreased productivity after lunch or breaks. 8. Non-work related visits from other employees or strangers. 9. Frequent trips to the restroom or water fountain. 10. Long lunch hours. And 11. Frequent visits to automobile and parking lot. The summary of effects of all the drugs have in common is reduced concentration, distorted vision, lack of control of motor skills, unnecessary risk taking, anger, anxiety, violence, apathy, fatigue, unpredictable responses to stimuli. My sources came from 49 CFR Part 40, also the Employees Guidelines, the guest speaker, no signs of symptoms. And also you can visit www.transportation.gov/ODAPC/Part 40, or you can visit www.gpo.gov. Thank you.